Welcome to the Advanced Women's Health Podcast, where we empower women with the latest insights and advice on holistic health. From cutting-edge medical research to practical wellness tips, our mission is to help you thrive at every stage of life. Join us as we explore topics ranging from hormonal balance and reproductive health to nutrition and mental well-being. Whether you're seeking solutions for a specific health concern or simply want to enhance your overall wellness, you're in the right place. Let's embark on this journey to better health together. This is the Advanced Women's Health Podcast. Before we dive into today's episode, I wanted to let you know about some exciting things we have been working on at Advanced Women's Health. So we don't aim to just be excellent at appointments and excellent with the care we give to patients in terms of the protocol, but our goal is cross-clinic excellence. We want to ensure that you are getting the most wonderful onboarding experience, that you feel supported, and that fundamentally you actually are going to implement your plan. We talk about health being a lifestyle, and it is, right? It is something that needs to be modified or shifted. We need to think about things differently. We need to understand our bodies differently. We need to have those education-based aha moments or those community-based aha moments to be able to action what we know to be true and what we know we need to do. And so over the last few years, we have been consistently evolving and trying to give you the best patient care experience possible. And that has resulted in us having our new patient onboarding system. All new patients at Advanced Women's Health now get access to a plethora of resources. We go through educational pipelines and daily tips and tricks that will help you to implement your plan. We have mindset support. We have onboarding coordinators that are there to create community and hold your hand in live QA calls. We offer meal templates and meal plan structures, exercise videos and programs, community challenges, and so much more. And again, this is just included as being part of a patient of Advanced Women's Health. So if you have been on the fence, if you have been hesitating, book with one of our patient onboarding coordinators. We are here to help you pick which practitioner is the best fit for you. And then you can learn more about our onboarding systems and everything else we offer at Advanced Women's Health. So now to the episode. Hello, everyone, and welcome to today's episode where we are going to do something a little bit different. So our team, you guys on social, people have been asking. They're like, why don't you answer questions? Why are you not on the firing end of these things? So we are turning the camera around. I have Dr. Sam with me here from our Brooklyn/Whitby as we're moving location. And she's just going to fire questions at me and we're going to go through and answer them. If you guys have questions you want me to answer in these segments, always feel free to hit us up on social. But yeah, we're just going to navigate them. There's not going to be a ton of rhythm to it. We're going to cover as many topics as we can. So let's do it AMA style.
Awesome. Okay. So yeah, the team's got lots of questions and input from their patients too. So we'll just get started in terms of muscle mass.
Yeah.
Would you agree that it is a very underrated aspect of health in terms of creating an anti-inflammatory terrain in the body? And if so, can you kind of elaborate and explain in a, kind of simplified way of how it acts as such?
Yeah. So muscle mass, we talk about just like zooming out. Muscle mass is important to so many different things. And it's like a really sexy topic right now. And so there's two ways to break this down. There is the benefits of having muscle mass, right? But then there's also why people maintain muscle mass. And these are two pieces. So when we're gaining muscle, so we always say our muscle mass as a general rule, or we historically used to say, peaks in our kind of like mid to early 30s. So we should be spending a lot of our youth gaining muscle mass and building it because that's when hormonally we're in the best place to do it. That's when our muscles are most receptive to growth due to inflammation, due to insulin, due to a lot of these different things, which is why when you're chronically unwell, when you're younger, or when you have metabolic challenges and hormonal challenges in your 20s, we say in the research, right, it can be hard to recover from that. We now know a lot more, right? We know you can continue to build muscle into your 60s, 70s, 80s in the right environment. It's not easy to do, but it absolutely can be accomplished, right? We know that muscle is an organ of longevity. It is so important to not only what we think about with our bone health. And so when essentially we've got a tendon and then we've got our muscle, and so that muscle is pulling on that bone. And so when we're doing resistance training, there's that physical contact, right, of pulling on that bone, which is then going to strengthen our bone. And so with muscle and bone, like if you don't use it, you lose it situation. And so it's really important for bone health, osteoporosis risk, posture, all those types of things. But muscle is also our main glucose disposal site. So this is why if you are a patient here, you will be exhausted by your doctors telling you to go for a 10-minute walk after you eat if you have blood sugar dysregulation, because there is essentially two different ways that we can take up and use glucose. And like this is again very oversimplified, but one of them is very specific to muscle after activity. So if you have enough muscle on your body, then you have these places for glucose to get used so that it doesn't build up in the system. And then we're not in a place where we are at higher risk of insulin resistance, etc. Right? We also know that muscle is very important for, again, supporting the overall health of the body. So when we get into it being anti-inflammatory, we do know that how healthy the muscle is, how your body recovers. We do know that's an important part of proper immune regulation. But we also know that when you have a ton of glucose kicking around, right, when you can't actually dispose of nutrients the way we want them to, that buildup can be a source of inflammation as well. To get like dirty nerdy into the research, there's something called a myokine, right? So it's essentially a muscle-based communication compound. So we call them cytokines when they're from the immune system. We call them myokines when they're from muscle. But there are specific signaling compounds that come from our muscle that are very important for our immune system, for our metabolism, for all of these other things. So again, we think make muscle to keep our bone healthy, but it has so many other implications than that. The other piece to this, though, is that if you're losing muscle, there is a reason why, and that's often related to inflammation, right? So muscle is the main place that we have protein in our body. So if we're not eating enough protein, we don't have like a healthy storage place for protein. And so muscle becomes the reserve. But we don't want to break down our muscle to let our immune system work. We don't want to break down our muscle to make enough chemicals in our brain called neurotransmitters so that our mood is stable. So we depend on eating enough protein to be able to support and stabilize that muscle mass. But if you can't eat enough protein, because your immune system is so overactive, there's so much stress and like breakdown because cortisol is what we call catabolic, meaning it breaks things down so that you can survive a stressor. So if we have really high levels of stress, if we have high levels of inflammation, then the body goes looking around for excess resources that it can use to keep us safe. So we oftentimes, in the face of low muscle mass, there will be high inflammation, but in the research, it's hard to tease out chicken or egg, right? So we always say there's a huge difference between causation, meaning low muscle mass causes high inflammation, and correlation, which is people who have low muscle mass can often be inflamed. And so there's definitely a connection there, and muscle mass is very important, but it's telling us so many different things. It's not kind of like just one silo.
Yeah, absolutely. Definitely started things off with a very large topic, but something that I did was thinking about when we were talking was around, when we're thinking about, okay, we're insulin resistant, but we also want to support muscle building. And this is kind of where that nuance with, let's say, a whey protein comes in.
Yeah.
And, the meatheads come in where
I was literally sitting here and I'm like, you are absolutely like, you should have a hat on right now that just says meathead because you are putting yourself in such a little corner when you're like, I just want to talk about this, which is great. Like, that's what we're here for.
you said ask the questions you want to ask.
Girl, I'm about it. Ask away.
Yeah. So my question would be to say, there's that balance where, okay, we have insulin resistance and we want to stimulate that enough post-workout without it also negatively impacting the ability to switch from, fat storage mode to utilizing glucose.
Yeah. Okay. So the big question behind this is, how much protein do you eat? That's what people want to know. How much protein do you eat? So I taught on this at the clinician level, right? So I did a whole lecture on like all things protein and muscle because there's so many conversations. And there's so much confusion out there from a consumer standpoint that we absolutely need to break down in a really big way. So at a healthy baseline level, so meaning if you are metabolically healthy, and the definition of metabolic health is that you can switch between using glucose and fat, right? Back and forth. Protein shouldn't really be a huge component of like what we use at fasting. So
yeah,
that is at fasting, you can just switch back and forth, right? So you eat a meal, you use the meal or store the meal. Between the meals, your blood sugar doesn't go too high, it doesn't go too low. You are able to just go back and forth. So in a metabolically healthy person, there are two ways, and I'm oversimplifying it, but I could give you 25 and then you would hate me. So let's stick with two. So there are two main ways that we are going to build muscle. One of them is we lift weights. We lift heavy things, right? And then you are going to damage that muscle a little bit, but you're also going to get the signal to grow. So you come in and you grow. So that's one signal for growth. Okay. The other signal for growth is eating protein. So when we look at protein, you've heard me say this before, protein is like a string of pearls. Okay. And on that string of pearls, there's white, there's pink, and there's green pearls. And so each pearl is something called an amino acid. And those amino acids, there's different types of them. And the different types of amino acids send different signals. Everything in our body is a signal. It sends different signals. So one specific type of amino acid, its name is leucine. And so if you hit enough leucine in a healthy muscle, it will tell your body, oh, there's lots of protein coming. We need to store it away. So you can stimulate muscle growth just from that. And so this is where the protein conversation can be very clear, right? You eat 25 to 30 grams of animal-based protein in general, right? Is going to give you enough leucine to stimulate your muscles to say, let's grow. That's an oversimplification, but like that's why we say 25 to 30 grams is because for an average animal-based protein, 25 to 30 grams will get you there. That is not true of vegan proteins. That is not true of a lot of our modified proteins. And again, but that leucine is a growth factor. So it is causing growth. So when we look at metabolically unhealthy or insulin resistant people, they have a high amount of insulin, which is a growth hormone. So they already have a lot of growth stimulus. And they are not what we call metabolically healthy. So every tissue in their body is getting a signal to grow. Their muscles, which is why it can feel like sometimes you put a sweater on, like if you start working out, you just get bigger and people are like, I'm like appreciative of the body comp change, but like I still have a lot of fat on my body. So your muscle grows, your skin tags grow, right? Or like we can see those skin change growths, right? Cancer can grow, right? The worst case scenario. Fat cells can grow. Like things just grow. Everything grows. And so what happens when we have this high level of insulin for a long time, yes, we still get those growth signals, but we also stop using all of the available nutrients to us. So we don't put things into storage as well as we used to be able to. It's kind of like you exhaust the system, right? If you're carrying things from your garage to your shed, it's summer. I don't know why I'm thinking about that, but you just keep going back and forth, right? Eventually you get exhausted and you're like, just leave this shit in the garage. Like it's going to be fine. But in our body, that's actually our worst case scenario. So what do we see? We see glucose levels go up, right? And then we measure that in the bloodstream. We can see something called a free fatty acid go up. So your body's not using glucose or fatty acids as fuel. So your brain thinks it's starving. It doesn't have enough fuel. We're not storing it away. It's just sitting in the bloodstream causing issues. And then the same is true of amino acids. Those little pearls, they build up in the system of someone who is insulin resistant. So you have all of this fuel available that you're not using, plus you have all the storage available that you're not using, but those growth signals aren't as efficient as they once were. So we get stuck in this loop of dysfunction, is the moral of that story, right? You have all of this excess kicking around. We need to use it up to then get access to our storage and to reduce the inflammation and the pressure and the stress in our bodies. But we aren't using it efficiently and effectively, which is where exercise is really critically important, because fasting allows you to use up excess nutrients and exercise allows you to use up excess nutrients. So then the meals that you eat can be more effectively put where they need to go. And so that between meals, you can more effectively pull things out of storage. So it's a very big way to get into the fact that your protein requirements are going to depend on the state of inflammation in your body. They are going to depend on how much circulating excess nutrients there are. It's going to depend on your age, like so many different things. And so, what we know to be true is that in young, very healthy people, they do not need as much protein to signal their muscles to grow after a meal. And when they work out, their muscles are ready to take on and they're like ready to rock and roll. So after a workout, your body is absorbing all that extra protein and amino acids. It's happy, it's good to go. When you are metabolically unhealthy and or, right, you are very inflamed or aged, we actually see this very, what can seem and feel a little bit confusing pattern where we need to use up those excess nutrients that are sitting there. But we also need to eat more protein at a meal to force it to go into the muscle. So, moral of the story is, if you are struggling with insulin resistance, you need to get that tested. So I need to know what's your fasting levels of nutrients and what's your fasting levels of insulin, that storage hormone. Ideally, I would probably like to know how much muscle mass you have in your body. Are you maintaining your muscle mass because the insulin, the growth signal is still active and alive? Or are you not maintaining that signal and you're starting to lose muscle, which is our worst case scenario? And so we need to customize your nutrition and your exercise specifically to that. But there is no one size fits all from a protein perspective, even though we're walking around being like, oh, you need 1 gram per pound or upwards of 2 grams per pound. That is a great general reference when we're trying to understand how much protein you need to make muscle. But that's based on healthy people, not necessarily someone who's struggling.
Right. Yeah, absolutely. And I think, in terms of, let's say, just people that when they work out, they're like, okay, we just did this. Now, how can we maximize the ability to build that muscle?
Yeah.
And, I'll do the same thing in practice where it's like, to figure out what we need to maximize after a workout, we do need labs, right?
Yeah.
We need to know if they're insulin resistant or not, because if you're not insulin resistant, then I'll be like, that's the time when you should have a fast digesting glucose, because you will
Yeah.
stimulate muscle production
Yeah.
more efficiently. But that's not going to be the case for someone who is insulin resistant, because
Yeah.
you're just going to be in that fat storage mode, so that those carbs are just going
Totally.
into your fat cells.
Totally. And that's the thing, right? Is so many people are so well intentioned. I have so many patients that come in and they have raging insulin resistant and they're right. They are like, okay, so how much do I have to lift? And like, what pre or post workout should I take to get the best benefits? And I'm like, no, queen. You know what I mean? Like, we have to go back so far, right? Like, because we are not at a place where micromanaging the types of protein you're eating and when you're eating them and the types of glucose you're eating them and when you're eating. We do not need to worry about that around a workout. We need to customize your general day-to-day meals based on your insulin. And then from there, we can look at your workouts and we can look at these types of things. But people get so hyper fixated sometimes. And you come from a bodybuilding background, right? Like, in order to get your body to do that kind of thing, you have to manipulate it to within an inch.
Yeah.
And for some reason right now, my Instagram feed is just like filled with bodybuilders posting about what their routines are on a day-to-day basis. Like, what a gift to me. Not really. Um, but it's when I'm looking at it, I'm like, this is why people get confused. Because like I don't spend a ton of my life on social, right? So sometimes I feel really isolated when patients come in and they're like, oh my gosh, I have to do this and this. And I'm like, okay, like just let's start with the basics. You know what I mean? Like, let's just put the fundamentals in. Like, did you have a solid poo this morning? You know what I mean? When was the last time you ate protein for breakfast? Because like if you're eating a chocolate chip muffin for breakfast, anything is an improvement. I don't necessarily need to customize exactly what the macronutrient breakdown of your post-workout snack is, nor should you probably have one. But truthfully, in that situation, you're good. So I think it's really important because we do cover the whole spectrum with the patients we see. We see people who are very coming in optimization, proactive, performance oriented. And then we see people who are coming in who truthfully are like, I'm so overwhelmed that I am the person eating the chocolate chip muffin for breakfast. And it's like, it's all good. We'll meet you where you're at. But that's why data is so important. And like, yes, there's the science. I just explained how muscle works, blah, 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 blah. But the data helps us to apply that science to your body.
Yeah, absolutely. And I think something that you just said was, there's a really big importance on focusing more on the quote unquote mundane thing, as opposed to those like sexy Instagram supplements that are influencer supplements that are out there. We always
like a greens gummy bear is not going to change your life, everyone. Someone sent me this company. I think it's called like Grun or something. I probably shouldn't say it. I don't know. But anyways, this company just sold for like a lot of money, like a lot of money. And it's literally a gummy bear with like a little bit of greens powder in it. And one of my friends sent it to me and they were like, oh, I should have invested in this company. I was like, please don't support that because that's not health. Like, as much as it may make you feel better that you're eating something like that, there's no difference between eating that and a Smart Sweets. You're not getting the benefit from the like minuscule amount of green things that's in it. As much as my children would like to argue, you know what I mean? Like, it's not.
Yeah. And that is also another good point where, we applaud, those health seeking behaviors. It's our job to then kind of educate around.
Yeah.
Yes.
Well, and I think like you guys are getting the version of me that my team gets. So whether this is going to come off as palatable or not palatable, we'll find out. I think every single human knows that a gummy bear that's green in color is not going to change their life. And like, I don't like gummy bears. You know what I mean? So like, I'm not your girl to be like, oh, I'll find an excuse to eat this random gummy bear company. But I like chocolate. And Designs for Health came out with like this GABA chocolate and they had like a theanine chocolate and it was in the US. So I was down there and I bought a bunch of them and it was really good. Like this nice dark chocolate. It's got supplements added to it. I'm like, absolutely. I guess I should take GABA all day. because it's a health seeking behavior. It's good for me. Was it good for me? No, it just tasted good. So it's like deep down, I knew I wasn't doing this beneficial thing to my body. I just wanted to eat chocolate and it was a great excuse. So it's like if you want to eat gummy bears and the green ones are slightly better for you potentially than the other ones, like rock on with your bad self. But I think we all know deep down. We all know.
Right. Yeah. If we want to actually move the needle and in a very more effective way, there's time to book with Advanced Women's Health.
Well, yeah. And like, if I could have my ass grow when eating gummy bears, I would absolutely do it. You know what I mean? Like, if there was a way to do it so that I just had a nice little, like, a beautiful glute situation, I would absolutely do it. But it doesn't work that way. So what do I have to do? I have to do squats like the rest of the world. And I have, you know what I mean? Like, this is just got to do the RDLs. It's got to happen.
Yeah.
So there is that piece of just like putting in the annoying mundane work.
Totally.
If you're like many of our patients that are struggling with your health, then you have looked into one of many, many, many programs online. There are programs with doctors, with naturopathic doctors, with functional medicine practitioners, with nutritionists, with people who have been through what you are experiencing. There are so many options available online. But the reality is, a lot of these programs are not medically guided. When you sign up, they say right away, this is not personalized to you. This is not personalized to your labs. I can't diagnose you, which is a huge limitation. They're also very costly. Many of these programs are $2,000, $3,000, $5,000 for a 3-month program. And that leads to you, one, not getting the best standard of personalized care, and two, spending money that you may not have to. And that's where our clinically guided programming has come in place. I have wanted forever to be able to give people an educational system, a week by week guide, an exact system so that you know what you're expected to do, what you're expected to eat, and how you're expected to navigate week over week over week over week. And I have been working with my team, my clinical teams, my clinical assistants to be able to roll out structured programs for you that are in the hundreds, not thousands of dollars. We are so excited to launch our advanced metabolic rehab, our fertility programming, and so much more upcoming. If you are interested in learning more about our structured and clinically guided programs, make sure you reach out to the clinics, info@advancedwomenshealth.ca. They will connect you with one of our clinical assistants and guide you through what programming might be best for you. The best thing is that these are in and above your appointment. So you are having your naturopathic visits, your acupuncture visits, and then we are layering on top a supported experience that allows you to utilize extended benefits should you have them, but that also allows you to get, again, a highly tailored medical environment. So reach out to us if you have more questions. And now back to the episode.
And kind of on the same vein of, influencer supplements.
Yeah.
Something that gets a lot of attention on social media will be probiotics.
Yeah.
And to that point, what is your kind of opinion on that? And do you find that there is a lot of clinical utility in them? And where do spore-based probiotics fit into there as well?
Yeah. So what a lot of people don't know is I used to be a probiotic researcher. So before I was an ND, I actually worked for a company that studied some of the most used probiotics in the medical side of things. So I've got a lot of opinions on probiotics, but then I also have a lot of just like facts and data on probiotics. So essentially, when we look, there's like different types of probiotics. And so to simplify it the most, I would say they're like different breeds of dogs. They're all dogs, right? But there's different breeds. And a Chihuahua and a German Shepherd have very different purposes in the human body, and they do different things. They respond better in different environments, right? Like it's very similar to how we think about probiotics. There's the conversation about like which probiotic is the best for you and most indicated. And we look at it in terms of what does it do to the immune system? How does it support and change the environment of the gut? How does it change other types of bugs in the gut. Each probiotic makes its own defense mechanisms. So they kind of make their own antibiotics. And so there's so many ways to choose probiotics that way. But then there's also, do you need a probiotic? So what a probiotic is doing is it's going in your mouth, right? Then goes into your stomach, opens up for the most part, unless you have a capsule that is controlled to only open in your intestines. Okay, so this is the different kind of compositions that we put in. All probiotics are sensitive to either acid, so meaning your stomach acid, they're sensitive to oxygen, they're sensitive to temperatures, they're all sensitive to something. And so that's also a factor in where you want it to go, helps you pick which ones are the best for you. But for most people, they don't need a probiotic. So when you're adding a probiotic, I know, right? When you're adding a probiotic, you're literally trying to use one bug to fight against another bug. And that's one way to approach it, but it also can be a very symptomatic way to approach it. People get a lot of bloating, a lot of gas, a lot of discomfort. A lot of the gut symptoms we also get is not from a lack of good bugs, it's from too many good bugs. So if you put more bugs into the mix, then you will get symptoms of more bugs, which is more symptoms. And so this is just like a fundamental thing we need to understand, is that more is not always more. So when we're looking at probiotics, again, we're looking to decide, is this something that the body already has too much of? And if that's the case, then we use antimicrobials, or we'll clear constipation, because your poop is largely bugs. So if you're not moving poop through, then there's a lot of bugs that are sitting in your system that are not doing great things. And when we talk about a condition called SIBO, so small intestinal bacterial overgrowth, what's happening is we essentially aren't pushing all those little bugs down. So there's two types of movement in the GI tract for simplicity. One of them is big contractions of poop, and the other one is these little teeny tiny sweepers. So I always say, if you take out the garbage, but you don't dust, right, then your house is still dirty. And so if you're pooping every day, but you're not actually moving those bacteria down, then you can get an overgrowth in the upper part of your stomach, bloating, gas, distension, all these things, and it's called SIBO. So the big question we have is why? Like, why do we have that overgrowth? And why are those bugs not moving through? And taking a probiotic doesn't solve any of those problems. So as much as there's great quality probiotics that can do a really great job, and as much as there are certain conditions like inflammatory bowel disease that have a lot of really good research on the support of specific types of probiotics in babies, right? Colic, eczema, these types of things, there's a lot of really great research. Probiotics are definitely overused in a lot of ways, because we are in a situation where we actually have bigger work to do on our blood sugar, on clearing constipation, on eating enough fiber. We have to kill off bad bugs that are causing a problem, right? We have to regulate the way our bowels contract. All of that work can be done to decrease the inflammation. And then we don't actually need a probiotic at the end of the day, which is always our goal. We're never coming in to try to use a supplement like you would use a pharmaceutical, right? Like, that's not our goal. They call it green allopathy, but the goal is to say, why is this here? Let's get to the bottom of it. Let's figure it out. And then we don't have the need for the thing in the first place.
Yeah, absolutely. And, in terms of, the Advanced Women's Health framework and how we operate when we see patients, that's, one of the reasons why I was so drawn to want to work with you, right? Because it makes so much more sense that you're trying to correct a physiologic imbalance of some kind, so that you can maintain eventually, as opposed to just needing something forever, right? Like a probiotic, for example. And then hopefully that also really helps to kind of debunk that, if you have a gut issue, don't just throw a probiotic at it. Yeah. Come see us.
Yeah.
And we'll tease that apart.
Totally. And the last thing I'll say here too, there's two different theories there's bug theory and terrain theory. Okay. So what does that mean? Bug theory means you believe, or the research believes, that there is one bug that has caused this issue, or two bugs, or the bug is the problem. Terrain theory is, well, in a healthy person, that bug wouldn't grow, it wouldn't take over. And so if you believe the bug is a problem, then the antibiotic is the solution. If you believe the terrain is the problem, then there's not one fix. We have to look at, okay, what's going on with your immune system? Why did your immune system let those bugs overgrow? It shouldn't do that. What's going on with your digestive enzymes? If you broke down your food properly, there wouldn't be so much food for that bug to grow on. Why are we here, right? If you have enough stomach acid, then we can kill off a lot of those bugs that come in through our food. If you have fluid movement of your intestines, then you can empty your bowels and you're not full of poop. If you have a calm nervous system, then things can move more efficiently and effectively, right? If you, like women with endometriosis, they're at a disadvantage just because of the amount of inflammation that's around their bowels. So the terrain theory is harder to do because essentially you're saying you have an overgrowth and your body has decided this is the most logical solution. This is the best outcome, is to allow this overgrowth to be here. So we have to look at why the overgrowth is there and then get rid of why that is the outcome your body decided to have. Not just look and say, well, this bug is a problem. Because I agree, like the bug's not great, it's a problem. But yes, it takes longer in terms of, it takes more time to talk about it. That's why we have long visits, right? It takes more different thought processes. Like I have to act like a gastro and an endo and like all these people all in one day. But it gives you a path and you're like, okay, it's likely one of these 2 or 3 causes. So here's how we're going to tackle them. And then when they get better, you're in a place that you're now not just without those bugs, but your whole health is better too, which is what's so important.
Yeah, 100%. And I think, especially in the context of kind of GI healing, quote unquote, or trying to relieve gastrointestinal symptoms, that, you can do an antibiotic and maybe feel better for a little while. But if you're not doing that other part, it's probably going to come back again, right? And I've seen that many times happen in practice, not necessarily probiotic or antibiotic as much, but antiparasitics or things like that as well. So
totally. Very good. Okay. Well, this was so much fun. Thanks, Sam, for coming on and asking me the questions. If you guys like this type of format, we will definitely do more. So let us know. And until then, have a great day and reconsider your probiotic.
Yeah.
Unless one of our doctors told you to take it and then it was a great idea. It's brilliant. You should do it.
Yeah. And hopefully you guys do like it because there were many other questions that we didn't get to.
Yeah. So, awesome. All right, everyone. Have a good day.
Thank you so much for listening. I hope that you had as much fun as we did. And if you loved today's episode, share it with a friend and leave us a review. That is how we spread this message, and that is how we are going to revolutionize healthcare in Canada for women. Have a beautiful day and be well.